Let's talk about the cost difference between these two restorative options. And I'm going to tell you, there's typically not that big of a difference. One of the things you should be looking for as a patient is the all-inclusive price. What I mean by that is you're going to want to be sedated for this procedure most of the time. That's a pretty significant cost. In fact, a dental anesthesiologist here in Las Vegas charges anywhere from $800 to $1,000 per hour, and we're talking about a 6 to 8 hour surgery typically. So if the cost up front is a little bit lower, however, you're paying separately for anesthesia, that can be a significant increase to your total cost. So what we find is the average cost for an all-on-X is somewhere between $50,000 and $70,000. The average cost for a 3-on-6 is somewhere between $48,000 and $60,000. So what we tell patients all the time is plan on it being about $50,000. It may be a little bit less, it may be a little bit more, kind of depending on what you bring to the table as far as number of extractions. Do you need extensive bone management, augmentations? Do you need a lot of bone grafting done? So there can be some variables in here, and that's why it's important to go to a consultation, talk to your treating doctor, and ask questions like this. But from the onset, this is what you can expect paying going into this. Now, keep in mind that you do have maintenance involved with both of these options, right? With the all-on-X procedure, this device needs to be removed every 6 to 12 months, cleaned, put back in. That can create stress on the implants and the screws, and it also requires that appointment to have it done. Nothing's different about the 3-on-6 in terms of how often it should be worked on. You should still go to your dentist every 6 months. In fact, if you do it through an authorized 3-on-6 provider, they give you a warranty on your 3-on-6 as long as you're attending your 6-month appointments. Now, during these appointments, the device is not removed. They're just cleaning it, making sure that your implants are staying healthy and staying in the bone the way they're supposed to. At my office, this will cost you $300 per year, $150 per appointment. Depending on the office you go to for your 3-on-6, that price may be a little bit more, a little bit less. What you find with the all-on-X appointments is you're typically spending about $500 per appointment, just depending on how many times you go there per year to have the work done. Now, most patients say after about 6 months, the all-on-X will start to get kind of stinky. They can taste it, kind of a sour taste. So even though an office might say, no, you don't need this cleaned except every 12 months, you might find yourself wanting it cleaned more frequently than that. So they have long-term maintenance costs as well as the upfront cost. So what I tell every patient is find out what's included in that. So at my office, I'm a 3-on-6 authorized provider. This is a all-inclusive price. This includes everything from your pre-op, your surgery, your post-op. We give our patients lots of stuff like a water pick and all kinds of little things like that to help the recovery. They also get my personal cell phone number. So that's one big advantage of picking your office is make sure you have access to your doctor. So if you have a question, have something come up on the weekend, you have somebody you can get in touch with. So we find this to be really important. Now let's talk about the next thing. Can I just go to Mexico, right? I don't know. I'm going to tell you, and this is not a lie, this is absolute truth. In my office in Las Vegas, Nevada, I am challenged with fixing something that was done in another country almost every single week. The challenge is it was done in another country. Getting in touch with that office is pretty difficult, and patients don't always have the ability to just jump on the airplane and fly back to Mexico every time they need something adjusted or looked at. So can it be done for a little bit cheaper in other countries? Potentially it can be, but think about the overall long-term cost of that if you need post-op and follow-up appointments, which you do sometimes. So up front, you can expect to spend anywhere from $48,000 to $70,000 to have one of these types of procedures done for you.